Welcome to Greater Texas Foot and Ankle Specialist. Hi, I'm Dr. Dean Kim, and today I want to talk you through what to expect after a minimally invasive bunion surgery. Now, I know many people feel very anxious about bunion surgery because they've heard recovery can be very challenging and very painful. But my goal today is to ease those concerns by sharing how my minimally invasive technique makes the process smoother and more comfortable for my patients. Now, unlike traditional bunion surgeries, my approach uses incisions that are just 2 to 3 millimeters. There's no hardware involved, meaning no pins, screws, or plates. Now, this leads to a smaller surgical footprint, less scar tissues, reduced swelling, and most importantly, a more comfortable recovery experience for my patients. Now, let's start with answering one of the most common questions. Number one, how long will you be off of your feet? With my minimally invasive technique, the answer is surprisingly 0 days. My goal is to actually have you walk out of the surgery room with your own 2 feet. Now, early mobility not only helps prevent muscle atrophy, but also speeds up the recovery process. Of course, while you'll be able to walk, it's important to limit your activity in the first few weeks. Simple daily tasks like using a bathroom, preparing meals, or running small errands are absolutely fine. And I like to say my patients are self-sufficient from the day one of the surgery. Now, the next question that I get asked is, what will I be wearing on my foot after the surgery? Many patients worry about being placed in a cast, but I never use cast in my practice. Instead, you will either be wearing walking boot or surgical shoes depending on your specific procedure. Now, more extensive the procedure, a walking boot offers the added support. For a less complex cases, a surgical shoes is usually enough for them. My priority is always finding the right option that ensures the best recovery for each individual patient. You will typically wear the boot or shoes for anywhere between 2 to 6 weeks, depending on the complexity of your surgery. Now, the next question I get asked is, what about the pain? What about the pain management? How painful is it after the surgery? And this tends to be the biggest limiting factor for my patients deciding on a bunion surgery. Now, this is another area where minimally invasive surgery makes a big difference. With a smaller incision, post-operative pain is usually much lower compared to a traditional open surgery. Most of my patients find that over-the-counter pain relievers like Tylenol or ibuprofen are all they actually needed. On rare occasions, stronger medication may be prescribed, but usually only for the first few days. Now, of course, everyone's experience with pain is unique, so I closely monitor my patients throughout the recovery process. First couple of weeks, rest is essential. You are gonna be resting, elevating your foot, applying ice for 15 minutes every hour to minimize the swelling. Now, lastly, question regarding a follow-up care after the surgery. I like to see my patients 3 days after the surgery to check their progress and to change their dressings. From there, I'll meet you with weekly for first 5 weeks. And I personally handle all of my post-operative care, including dressing changes, splinting, so that you can feel comfortable knowing the same surgeon who performed your surgery is guiding your recovery process. As the time goes on, you'll gradually return to your normal activities. Recovery timeline vary depending on your lifestyle and activity level. Things like high-impact activities may take a bit longer, while a low-impact task can be resumed a lot sooner. Now, let's recap the key points about minimally invasive bunion surgery. Number one, you'll be walking on the same day, either in surgical shoes or walking boot. You'll be able to be self-sufficient. Number two, over-the-counter pain medications like Tylenol and ibuprofen are usually enough to manage the discomfort. Number three, you'll have minimal scar, which is aesthetically very pleasing. Number four, you'll have no hardware such as pins and screws in your body after the surgery. And lastly, I personally oversee all of my post-operative care so your healing is proper. Now you'll have peace of mind knowing that my staff and I'll be with you throughout every step of the way. And if you'd like to learn more about and think you might be a good candidate for minimally invasive bunion surgery, feel free to call our office at 469-384-2135. Now, don't forget to like, comment, or subscribe to our channel for more helpful information. Thanks for watching, and I look forward to helping you on your next journey to a healthier feet. Thank you.